You do it by yourself or should I help?
He's gonna give us a demo on what we do to adjust the horse.
I'll stay up here.
We will go through kind of the whole adjustment. Just gonna check him over, feel some pressure points. He's a little stiff in the hip here. And they will move around a lot, that is normal. Until they figure out that it's a stretch that feels good. There you go. Just a little wither sore here. Check the saddle fit. You're at the end. Lots of good findings. He's pretty sore. Good boy. I'm sorry. Has he ever been adjusted before?
Not that I know of.
Okay.
He could have been, but not to my knowledge.
Okay. It's definitely a little weird for him, probably. Definitely have a lot of spots in our main spine and our pelvis. It's pretty big, so we need a step. And he's a head horse.
Mm-hmm.
Okay. This takes a lot of pressure at the withers. So his pelvis is restricted right in the middle, so it can't make a nice really figure eight flowing motion. The goal is just to restore some motion.
And he's got just a wicked face. The way that he whips his hips
Comes around.
the face is up.
Yeah.
Mm-hmm.
Yeah, so he's pretty athletic and pretty talented, and maybe a little hard on his body. He's really leaning into the pressure points here. He likes that. So just getting him to kind of tuck up under to get some range of motion up through the lumbars here. There, that's a good release. Big deep breath. Licking, chewing, yawning, any of those things will kind of give us a signal that he's feeling better. So the goal is to get more motion into the vertebrae. We're just getting a tiny amount of motion, and then that's going to help us get more blood flow, better lymphatic drainage, better range of motion, help the muscles feel better. It can even help their immune system too.
He's like that.
Yeah. So they have 18 thoracic vertebrae, and those are the vertebrae that the ribs come off of. And so most of the time, people think their horse's ribs are out, but they're really not. They're just these thoracic vertebrae being restricted, and they have rib pain. So if you correct the main spine first, a lot of times you won't actually find the ribs are out. So that's kind of a fun thing. The lady that taught animal chiropractic at the Animal Chiropractic College in Louisville, Kansas, someone asked her if the ribs are ever out, and she said, "Where do they go? Out to lunch?" They're attached. She's pretty funny. I have seen a few ribs out, and they taught us, how to fix them. And most of those cases are horses that have been in like a severe trailer accident or flipped over backwards or something really traumatic.
Something tragic happened to them.
Yeah, something really, really dramatic.
They're not stepping up on something and blowing a rib out.
Right. We're not gonna turn a steer and have 5 ribs out. You know, it's not super common. If you step on and walk, it might scare you. He's pretty calm. He doesn't seem to care too much.
He doesn't usually care about too much of nothing.
Yeah, so I'm putting a lot of pressure on there, and he's super happy. So we got that fixed on that side. So a lot of times they're really sore when we start out, and then by the time we get through the adjustment, they should be comfortable. And that's the goal. They shouldn't still be dipping and pinning their ears and jumping around. They should be really relaxed. And he's settling into it really well. Sometimes their sternum will be out too. This isn't too bad. Good boy. You like it? Maybe? It's very sweet. Very appreciative. From both sides because these lumbosacral vertebrae, which end at the left rib and then come into the lumbars, come into the sacrum, which goes down into the tail. So sometimes they can be rotated, the main spine here can be rotated to the left or to the right, or just stuck up or down. So just want to check each vertebral segment from multiple angles to make sure you don't have a rotation. He's got a little bit of rotation in his lumbars here. That tickles. These are just some little stretches that I use to assess pain and range of motion. Scooting away. That's what we teach him to do, move off the pressure, and then we want him to stand to take the pressure.
Stand up and take the pressure.
Yeah. It's not really fair, huh? No, he's doing great. Move away from the pressure. Oh wait, I think I like it. I'll go back. There we go, good. Good job.
Yeah, he pushed into that one good, wasn't he?
He's smart. Knows what's good for him. So he may be just a little more sore today. So we usually have people give him the next day or two off. They can be turned out. It's better if they get, move around, get some good movement. Yeah, don't get so stiff. But if you notice it being just a little stiff or sore this evening, that's kind of normal.
Okay.
When I go to the chiropractor, I usually leave hurting.
Hurting worse.
But the next day I feel better, yeah. I always tell people it hurts so good. It's a good hurt. That's much better, huh?
That's so much better.
Yeah. Really feels good. So what are you doing back there? Do your head and your neck next. Got a great top line. Really good axial muscles. Really strong through here.
Yeah, he, when I got him, his top line wasn't very good at all. It's
Really?
about the only thing we've been working on the past
Yeah, it's taking a
4
while.
months.
Yeah. Yeah. Good boy. This pull is pretty tight. Good job.
And he is tight when he's in the box. He keeps.
Cotton senses and holds tension there. Yeah. calm down a little. There you go. Good. Feel better? There. Good deep breath again. More licking and chewing. There. You're really good at licking your lips. So I think the T-Rogan horses always are out in their left neck and shoulder. So we'll see if he's no different. That's what they do. They go left. I tease a lot of my T-Rogan clients and I say, do you lope as many circles to the right as you do the left? Because you go to a rope and everybody just loping to the left. I'm trying to get you guys trained.
I'm one of the rare ones.
Are you?
I take a good hour and a half to get warmed up.
That's good. Very good.
I'll usually walk in for a good 30 minutes first and trot all around and then I'll start warming up.
Loping. Yeah, good. Yeah. A little tension in your shoulder, but not as bad as some.
Good.
Taking a lot of breaths. I feel good. I'm always amazed at how many times they usually do turn and look at me like, okay, I'm just going to check my range of motion here and see if it's better. I can palpate the muscles too to see if there's any muscle swellings or anything that's still tight. So they have 7 neck vertebrae. So 1 and 2 are up here, and that's what we call the pole. And that's whatever I just did whenever I had his head on my shoulder. We'll do the other side in a minute when we get over there. But 6 and 7 live kind of under that shoulder blade. So sometimes we kind of have to poke to get down in there. So sometimes they're annoyed because that muscle is sore. So
yeah.
we can kind of lift the leg and move it around if we need to, but he's great. He doesn't care if we dig around in there. So TMJ or jaw can be really sore, especially in horses with dental issues. I always recommend getting the teeth floated at least once a year by someone who knows what they're doing with teeth floating, because we don't want the teeth to get too short or ramped. Sometimes people forget there's teeth way in the very back. So do you have bad teeth whenever you got it?
No. Yeah, he's been good. He's always taken care of really well, but I don't know as far as chiropractic and all that.
Is there anything extra?
I should say he was used very well.
Yeah.
So the things that go along with using one were taken care of.
Okay, gotcha. Good. Feel better? He's really rewarding to work on because he kind of just comes back to neutral. Kind of gives you a I feel good expression. You gonna adjust your own pole? There. Sorry, I know it's sore. I know. It's like, I'm telling you, this side's worse, okay? Maybe first and stretch it. That work better. You're pretty tall.
Yeah, she's okay now.
He doesn't let me reaching across it. See here. There you go, good. So I knew it was stuck. I didn't really want you digging in there. Does that feel better?
The rest of the side down a little lower.
Okay, maybe it's not so bad. I'm automatically on guard though that I'm going to do something else in the way. Cool. I'm going to have you turn his nose towards my shoulder here. That's great. That feels pretty good. It's a little tense in the right shoulder, but not horrible. really good rest on your shoulders.
The ginger's gone. Relax.
There. Now you can try it out. Feels pretty good. You don't hate me too much. We're friends. He's so sweet. So appreciative. That's what makes it so rewarding whenever they lick and chew and come and say thank you. How old is he again?
10.
10. It's the perfect age. Good. He's got really good range of motion. I like stretches. I think you'd stand there all day.
He likes those a lot.
So when we do these, I'm just checking range of motion in the ankle and the knee, elbow. And pull it forward and just give them a good stretch. Left shoulder down into this left front leg is a little tighter than the right, but that makes sense with his being a head horse. Left you. I like just giving them a minute to kind of enjoy their licking and chewing and that little sigh of relief. Just gonna check his ankle range of motion, his hop, his stifle. It feels good. Got a beautiful long tail.
When it doesn't get broke off in the mud.
Yeah. This is getting turned out and enjoying being a horse.
Oh, yeah.
Okay, if you want to kind of bring him forward or turn him, I gotta do this. There we go. Good. Alright. Got some tension in his tail, so I just like to give him a little bit of a stretch. There's several little vertebral segments all the way down through the tailbone too that we can't forget about. Sometimes they'll get them compressed. The thing that's most important with the tail pull is not to let go of it quickly, let them kind of take it back, because if you don't and you spring it, you can actually cause them to have some neurologic issues because it'll bunch up that derogator that lives around the spinal cord.
Huh.
So yeah, just a nice gentle pull, and kind of give them a little warning to take their body weight back. Some of them will pull hard. He pulls hard too. He likes a good tail stretch. Okay, you're all done with this part. We'll check your saddle fit. So we'll put the saddle on without the pad first.
And I know the saddle does not fit in good.
Okay.
I usually will get a saddle for each horse.
Okay.
And I haven't fit for anything.
Okay.
I think this sits just a little too low on him.
Okay. Yeah, you're right. So when saddles are too wide, they sit down on a wither like this, so you have no clearance. Like your top is sitting right on the wither. We like to have, at least 3 to 4 fingers. So we ideally want to bring this saddle up. It's too wide in the gullet here. So we kind of want to bring it up with a little bit of a wedge pad.
So more of like
just a wither build-up pad. But this saddle doesn't fit in well. Really, because if it was just truly too wide here, then whenever we would lift this up, the back would come down. The back's already pretty far down here, so these laces are already going to kind of dig in those lumbar vertebrae. So it's really not a good fit for him, and it's not going to be super easy to cheat with pads either.
Yeah.
Especially with him being a head horse and taking the hit whenever you go to valley. So yeah.
What size gullet would you recommend for him?
He's kind of hard to fit. Let's take this out and look at his shape a little bit better. So he is, I don't know what size the gullet that saddle is too.
7.
That's a 7?
Mm-hmm. Might be a 7 1/4.
Okay. I would say a 7-inch bullet would be okay for him. So it may be the bar angles in that brand of saddle.
Okay.
That's an issue. So he is kind of, I know he built his top line really good and we've gained a lot of the maxillomuscular through here, but through here, he's a little bit lower.
Mm-hmm.
And he has kind of medium shoulder. I mean, he's not super wide in the wither, but he's also kind of narrow, so he looks a little taller, but not tall like a thoroughbred either. So he kind of has a heart shape, and then he comes up back here where that back of your saddle would sit. So you may need a pad where you kind of build up this part.
Okay.
And then you'll need bar angles that kind of give you a little bit of flexibility.
Okay.
Because he's going to be a little bit challenging to fit. I would have thought that we have to measure, but that saddle to me looks like a 7 1/4 or 7 1/2 bullet. I might be wrong.
I get 7 1/4 for sure. It could be 7 1/2.
I would say he looks like he would fit okay, like in a straight 7-inch, like Corriente, Martin, something like that. But yeah, I would not buy a saddle without trying it on him.
Yeah.
So whenever you go to try it on, put the saddle on without a pad. Run your hand down the front, which I can't really show you on that one because it sits down so far. So you want to make sure you got, first things first, a little bit of space above the wither. And then you'll want to run your hand down the front of the saddle, find the bar angle, which is usually back about 1 inch or 1.5 inches. And that doesn't need to pinch the shoulder. You want to make sure that has clearance.
Okay.
Make sure you don't need bridging back through here. Make sure you don't have laces that are digging into the spine but aren't like sitting up way high either. And then you'll want to feel under each concha and make sure that the fit is even. You know, if one's really tight and one's really loose, then that's not good. Or if you're like, oh my gosh, these are pinching my fingers. It'll feel snug because your fingers aren't supposed to be there.
Yeah.
But you don't want it to be like super, super tight.
Yeah.
So those are some things to look for. Honestly, if you've been have you been roping in him?
No.
That's how. Oh, okay. I was like, his back is way too good.
No, I haven't been roping in on that.
Okay.
I've been using a 7-inch Todd Sloan saddle.
Okay.
It fits him a little bit better.
Okay.
But until I actually got him fit, I wasn't gonna get anything.
Sure. No, I understand.
So I figured out what he needed.
Yeah.
And I like these pads a lot.
Okay.
The contour fit with the 1 1/4 inch belt. Is he gonna need something with kind of that gel or that impact in here to the withers?
Like a buildup, you mean there? Maybe it's gonna depend on the saddle.
So to get enough fit in the saddle. Right?
You should need one. Yeah.
Okay.
Yeah. I'm just gonna bring this up. It's not gonna be pertinent to him because he probably will use a thick pad because he's not super duper wide here. But if horses are wide and the saddle is already snug, that's gonna be way too thick of a pad. Like you're gonna need a thinner pad.
Okay.
And I think that's kind of something that's been a misconception. I know growing up we just double padded everything in the store. You just add more pad.
Yep.
But actually creates more of a tight spot.
Okay.
So, but for him, I think, the pad's going to be fine because you're going to fill this out. And actually, when you put the pad on some of these saddles that look like they'll fit that great, you can cheat them.
Yeah.
And the goal is, at the end of the day, is the horse comfortable? Is the horse sore? Are you getting white patches of hair? Are they mad when you're going to cinch them up? Things like that is things I look for. I don't get too worried about dry spots. As long as, if you have a dry spot on one side but not one on the other side, then I get worried. If your dry spots are even, not too
worried about it. So at least the pressure's even.
Yeah. But I think sweat patterns are hard to obtain properly. You need to ride a good heavy amount of exercise for 20 to 30 minutes and even sweat, and then check right away. Not walk them out, cool them out, because it's going to help change. It can change your sweat pattern. So I don't get too worried about sweat patterns if the horse is comfortable and they don't feel like they're being pinched or too much movements too. If they're not getting pinched, but you're getting, if you have a really high back on the back of the saddle and then it's bouncing, that's when I see a lot of lumbar pain. I also, in these short backed horses, I don't like to see the saddles and the pads getting into the pelvis. I like them to have plenty of room to move this hip.
That makes sense. Not pushing it up back here.
Right. Like your pad and saddle should end
just before the head.
Yep, like at least an inch before that hip bone, so it has plenty of range of motion. Same with the shoulder. We want to keep the saddle. We want to not inhibit the shoulder, but really your bars don't start, like I was saying before, till about an inch and a half after that front of the saddle skirt. So you're okay usually. You want your girth to kind of hit inches behind the elbow. If everything's in proper place, you shouldn't be pinching your shoulder. Your shoulder should have enough range of motion. But I think we get worried about the shoulders, so then we scoot the saddle back, and then now we're in the way of the hip.
Yeah.
So, the shorter back horses are where it's more of an issue than these bigger horses, of course. But, so that's something we're trying to, and making sure your girth fits properly too.
Yeah.
Especially these rope horses, they're going to take a hard hit on the girth period too. His sternum wasn't super sore, and he has good lift range of motion up through his back muscles. So, looks very good.
Awesome. We'll see you again in another, month?
Yeah, probably.
Perfect.
Yeah.
Well, I appreciate it.
Yeah, we'll keep him on a maintenance schedule. Most horses I see probably every 4 to 6 weeks, especially if they're being athletic and using their bodies really hard, or if they have poor conformation, or just kind of struggling, going through some maintenance things, arthritis, things like that. But yeah.
Awesome.
Do you
Well, I
have
appreciate it.
on a joint supplement?
Nope. No, the only thing we're gonna do, slowly but surely, I don't know whether we're gonna do the Hilltop Bio, their amnion product, or the Pro Stride.
Okay.
Just start taking care of.
Joint maintenance and stuff.
Yeah.
I really like the Platinum Performance CJ feed through joint supplement.
I've been wanting to actually try that too, because that works good for dogs too, isn't it?
Yeah, they have it for dogs and people too.
Yeah.
So that's a good one, and might look into it. Yeah, he's a good horse. He's a really good patient.
Yeah,
He did
too.
great.